Hi, good morning, good afternoon, good evening to all of you, all of the colleagues. Thank you of the thirst of World Traditional Medicine Forum invite me to share some of my experience. Today, I would like to discuss the how application of traditional Chinese medicine on COVID-19 in the Philippines. First, I would like to discuss the basic series, foundation, and development of TCM treatment to COVID-19. In Chinese medicine, we consider COVID-19 belongs to the TCM concept of the plague, same as the epidemic disease. And is the pathogenic cheese invade to the lungs and other organs. And the cause of the principle by the dampness, heat, toxic, and stasis. In Yellow Emperor's classic of internal medicine, they emphasize 正气存内，邪不可干. It means you keep healthy qi and the aviar qi does not disturb you. By the plague theories, they mention externally contracted disease does not infect people, but epidemic disease infect people. The evil of epidemic diseases come from the mouth and nose. So there are two ways to spread the plague, through the natural environment and through the contact with patients. They spread in different ways, but they are infected with the same evil. So they call similar right now the concept of the aerosol. And it took some time for the plague to come. And after it had been infected with evil. So similar to the concept right now, we're talking about the incubation. So for COVID-19 incubation around 1 day to 14 days. As the guiding principle, they said, sense prevent disease rather than cure them. So they emphasize how it is the prevention and pay attention to hygiene. Dr. Wilker is steaming the process of infected family members on a steamer to prevent the rest of family from getting sick. About the drug prophylaxis, we should avoid going out during the plague and try to go out late and go home earlier. And usually burn changzhu in the room or chew garlic in mouth. About the quarantine, to stop the spread of the respiratory tract, then you want infect by avid. You want to get sick. Second, we refer about the reference of clinical experience and modalities of traditional Chinese medicine on COVID-19 in China. China is the first discover COVID-19 last year's, the end of the 2019. So they accumulate the rich experiences and they combine the traditional Chinese medicine as the part of the protocol of treatment. So those of the experiences in China and protocol of the TCM application on COVID-19 be given by DOH in China and has been a part of the guidelines in the Philippines. And we organize society member association and TCM center, all of the practitioner and expert to attend the Dr. Zhang Li's lecture and even other experts, the lectures. Those organized by the World Federation of Chinese Medicine Society and World Federation of Acupuncture and Motivation Societies. At the same time, the China medical experts team visit in the Philippine TCM Center to share and exchange the COVID-19 TCM treatment protocol in China. Those of experts, they went to Wuhan. they have a first-hand experience. So it's very important to us how to combine in our local condition to come out of protocol. Of course, evidence basis is the most important. So we refer the different literature to support and how and why Chinese medicine work on the COVID-19 is effective and is important. This is from the Dr. Zhong Nanshan's team. Dr. Zhong Nanshan is academician, the member of the National COVID-19 Expert Group. And this is the literature published by the International Journal of Clinical Pharmacy, the last 2020. It says many TCMs also have potent anti-inflammatory and immunomodulatory effects. The treatments based on syndrome differentiation is one of the significant features in TCM. And TCM compounds contains the variety of active ingredients that have proven multi-target effects and making it difficult for viruses to develop drug resistance. Of course, in Chinese medicine, we're talking about the lifestyle and exercise. So before the COVID-19 in our TCM center, we organized patients for the different exercise, such as the Baduanjing, Tai Chi. There are 4 formulas from the Dr. Li Chandong, who is our chief expert of TCM center. And we work together based on the constitution, most of the patients' constitution in the Philippines. We form the 4 formulas based on their cold dampness of constitution, or the heat dampness constitution, or yin deficiency or yang deficiency. For cold dampness constitution, we ask for the 树叶、藿香、陈皮、草果、生姜 as the tea. Drink it once a day or twice a day for 1 week, and to enhance your immune system. If for the heat dampness constitution, we suggest apply the 藿香、厚朴、杏仁、六一散 as the tea for 1 week. And yang deficiency, we organize the 黄芪、桂枝、生姜、树叶、藿香. And for the yin deficiency, we suggest use the 百合、金银花、竹茹、树叶 as the Chinese herbal tea once a day or twice a day for 1 week. So at least your constitution can be improved. Of course, we suggest using the burning and fumigating. The purpose to kill the pathogen by this is kind of the herbal medicine, like the 艾草、雄黄、沉香. By the way, there's another approach wearing perfume sachet. Perfume sachets, we use some aromatic herbs like the 藿香、佩兰、贯众、香火、白芷、菖蒲、苍竹. We put together as same quantity, and to put in the box, we just place beside of your pillow, and once a week, the environment pathogen can be killed. As the protocol of the syndrome differentiation, we adopt of the China protocol on the traditional medicine for COVID-19. But most of the cases, we're using the telemedicine, online consultation, and later I will introduce, we usually apply of the one-off application online. So if for the mild condition, for the cold dampness and stagnation lung syndromes, the medicine will be given as the formula is attached. If the dampness and heat accumulation lung syndromes, then this is the formula will be given. For the moderate condition, the most with the dampness and stagnation lung symptoms, all of the based on syndrome differentiation, then the formula will be given as attached. But of course, it's based on individual condition, we need to modify, not just the fix of this formula. For some of the cold dampness lung symptom, we give another formula. So this is usually the protocol we have given. But of course, we understood the situation and challenges of TCM treatment to COVID-19 in the Philippines. Since it's the first, some experience in China is not really different season, different of the constitution of the patient lifestyle, how we can copy from the other country or different area. We have to, according to the different time and local condition and personal constitution, we need to do some adjustment. And in the Philippines, you know, the conventional medicine is the Western medicine. So Chinese medicine is a part of alternative medicine. So we would know how and where we can do it. As a part of Chinese medicine, the acupuncture become always the sum of the protocol for recovery stage. We call the acupuncture intervention. So what is the purpose here? To eliminate remaining pathogens, to restore the normal body function, enhance the repair of organ, restore of the function of the lungs and spleen function. The COVID-19 patients usually we affect two systems. In Chinese medicine, we call the tai-yin. So tai-yin, the hand tai-yin lungs meridian and foot tie-in spleen meridian. So most of the symptoms with the storm, digestive function and relate to the lungs. So for this is the one we consider moxibustion is very important for the lungs and spleen qi deficiency. Some of the meridian, some acupoint can be considered moxibustion. And for those the qi and yin deficiency after the or post of COVID-19. So even the swab test, your PCR turn to the negative, but it doesn't mean say your conditions to recover completely. So this is the Chinese medicine and acupuncture can perform is the much better. There are the several of acupoint could be considered. You can do by yourself for acupressure. For the moxibustion, this we suggest give the guideline and exercise to enhance the meridian energy flow. At the same time, we suggest the severe medicative diet for food therapy. Since the spleen is a part of important to support recovery of the COVID-19. So this is the one of the tonifying spleen and dispersed dampness, spare ribs tonic diet. This is the one of the formula. Another one is the tonifying qi and blood by pigeon tonic diet. So this is another soup to support the qi and blood deficiency. Summary, the strategy of TCM was in COVID-19 right now. The implementation strategy of TCM, the prevention and treatment of COVID-19 in the Philippines. The first, we suggest the person with the close contact with COVID-19 patient but has not symptoms, asymptomatic, the TCM HERS for preventive formula could be given, and confirm the COVID patient with not symptoms to light symptoms. The three patterns, medicine and three herbal formula could be considered. But of course, we have to follow the local FDA's the guidelines if they allow us to use or is approved by FDA. If not, the herbal medicine is no problem to use in the Philippines. And based on the underlying disease of the patient, main symptoms and stage of development of disease, control the disease so that the progression of disease will be reversed until it's fully controlled. For the recovery phase, the TCM herbs, acupuncture, emulsion, and acupressure, 八段锦, qigong, tai chi, exercise, we suggest and advise. And we're developing one which application we call the 月人小宝 for safe health management. So patient can catch off the picture of the dance and able to see what constitution you are. This is we work with is the Fujian University of TCM. But since it's COVID-19, not only the one of the disease since the outbreak, all of the country, the medical resources is very limited. So we believe through the society or community support can help more of the people, particularly in the Philippines, the medical resources very limited. Even the ER, even the COVID-19 ward is really limited, not enough. Many patients have to stay at home. So we work with the Federation of the Commercial and Commerce the Industry in Philippines. We organize the community symposium to discussing the society supports and sharing how TCM works on. And this is the federation with the community. They organize the fund for the Chinese community, even for the mainstream society support, to give the preventive medical equipment suppliers to all of the society. So this is the very special in the Philippines. We not only work on the professional side, we support by the community or of the association. And we invite a different expert from China to share the experience to our practitioners. So this is through the different group show you. As the conclusions, the effectiveness of traditional Chinese medicine in the fight of COVID-19 is based on the principle of traditional Chinese medicine of customizing treatment based on the patient's constitution and geographical condition while considering the time element. The earlier use of TCM herbs, the higher would be the chances of recovery and is the most important strategy in addressing the virus. This strategy will also diminish the burden on the healthcare system of the Philippines, control the spread of the COVID-19, and allow us to return to our normal lives before pandemics. Mabuhay and Philippines. I can show you the one of the figures in the Philippines. Our TCM expertise team and TCM center support more than 4,000 patients directly, and some of the give lectures for community, more than the 20,000 audience to attend, to adopt, and we have to give the more than the 50,000 packs of the free of herbal medicine to the different community and to support it, to work together. That is what I would like to share with you. Very simple, but I think is the hopefully for you to understand what happened in the Philippines. Salamat po. Thank you very much. Thank you.